is Dorothy Michaels. Not Tootsie, Dorothy. D-O-R-O-T-H-Y. As your hospital administrator, I've come to talk to you about a very serious problem. Could we have the first slide, please? Look how much money you can spend to determine a diagnosis in a chest lesion. $250 for chest tomograms, $500 for chest CT, the same for pulmonary arteriography. I've asked Dr. James Scatliff to talk to you today about using simple fluoroscopy. Remember, we have to save Medicare dollars to support the hospital cafeteria. Dr. Scatliff?
Dorothy, baby. Thank you. Next slide, please. It indeed is true that the first fluoroscopy was done for Conrad Röntgen's barium enema. Next slide, he shows his appreciation in this slide. And the next slide, look at this patient who has a possible chest mass in the region of the azygos node. If you fluoroscope that patient, next slide, in the supine position, see how large the cava azygos is here. It's small here. That's an azygos verax. No need for tomography or any other test. Next slide. Here are some indications to think about when you're confronted with a nodule versus a vessel, lung versus a rib or bone lesion. We're familiar with these sorts of things for fluoroscopy, but simple fluoroscopy can help determine what's what. Next slide. Here in the child is a patient with a very poor inspiration. Is that heart too large? Is there a pneumonia here? Is that bowel in the right place? Fluoroscope that chest. Next slide. And one can see in a deep inspiration with a child crying, it's all normal and the bowel is back in place. Next slide. Some indications in childhood to think about fluoroscopy for are these. A thymus will change in size, a mass will not. Heart size you saw, pneumonia versus normal lung. Air trapping is a helpful thing to assess in fluoroscopy. Next slide. In this patient who said he thought he swallowed something when he drank his Coca-Cola and had chest pain, the chest film can't show us anything. Next slide. In the lateral film, the fluoroscopist or the radiologist thought, gee, there's something here. I'm going to fluoroscope that. And he did. Next slide shows that with proper projections and rotation, that's a pop top down in the lower esophagus. Next slide. And so, remember, a little fluoroscopy goes a long way, and it's cheaper. Thank you. One more slide. One more slide, please.